Hi, friends. Welcome to today's episode of the AOCPMR podcast. I'm Meghan Mardashti, one of the AOCPMR's Multimedia Committee co-chairs and your host for today's episode. Today, we are thrilled to have Dr. Unoma Akamagwuna join us. And she is an assistant professor and the fellowship program director for Pediatric Rehab Medicine at Baylor College of Medicine, and is very passionate and a huge advocate about shaping the future of pediatric rehab medicine while making a difference in her patients' lives. Thank you so much for being here with us, Dr. A. Can you share a little bit about your journey and what led you to specialize in pediatric rehab medicine?
Absolutely. And thanks so much for having me. It's a pleasure to be here. So I was one of those rare people that knew I wanted to do peds rehab before I came to medical school. Um, I went to Xavier University in Louisiana, and one thing that Xavier does a really good job is starting on the path to med school really early. So I did many different summer programs over the course of time. One summer program was in the Department of Biomedical Engineering at MCW, and she was also in the Department of Physical Medicine and Rehabilitation. And so I knew I wanted to do pediatrics, but then I discovered PM&R, and I was like, does pediatric PM&R exist? And it did. And so I knew once I was going into medical school that I want to do PM&R, peds PM&R. So I did some time in medical school, did some shadowing at Children's National Medical Center, did some shadowing at Hopkins as well to kind of make sure that this was indeed the right choice for me, and it was. And then ultimately, I did my combined residency program at the University of Colorado in Denver, and I'm here now.
Love it, love it. I can only imagine um, the path that's really good because I feel like a lot of times people do have that interest in working with kids, but it usually is initially pediatrics, and then if you have some interest about functionality, then you're like, maybe peds rehab could be a good choice for me. But that's really awesome that you kind of had that idea earlier on.
Mhm.
Um, so, can you tell us a little bit about what a typical day looks like in your practice? And obviously, with the caveat that you are more so in academic medicine, so that might be a little
Mhm.
bit different than if
Yes.
you were to be an outpatient. But yeah, any insight would be awesome.
Yeah, absolutely. So my day varies. One of the many, many reasons that I love peds rehab, which I can get into, is that my day is always different. Each one is not exactly like the other. So sometimes I do outpatient medicine, and so that's when I have typical outpatient clinics. And then sometimes I do consults, and so that's when I see consultations in the hospital. So new injuries, we're seeing those kiddos or kiddos that have had multi-level surgeries, we're seeing those as well. Or sometimes we're seeing kids that we follow in clinic already that are in or are sick and are having more difficulties with their tone, and we help to manage that. So my typical week, Monday mornings, I have clinic. It's a general rehab clinic. So I see kiddos with CP, various other diagnoses. Then in the afternoon, I have an admin day. So this is where the academic part comes into play. So usually I'm doing something related to my administrative tasks, having meetings, sometimes conducting interviews. And then Tuesdays, I also have more clinic. I also co-direct the spina bifida clinic for our hospital. And so I see some patients in the morning, and then we have our multidisciplinary clinic in the afternoon. So what that looks like is we have clinic in conjunction with neurosurgery, with urology, physical therapy. We have social work in clinic with us. We have our dietary colleagues in the clinic with us. I think I mentioned physical therapy already. And then also we're really fortunate to have a transition medicine component. So we have one of our colleagues who also sees our spina bifida patients in the adult side, also in that clinic in the afternoon too, and child life. So it's a really like great interdisciplinary atmosphere. General clinics on Wednesdays, half clinic days on Thursdays, half and full clinic days on Fridays. So it's really like very different what I do. At least once or twice a month, I have procedure days. And so I'm doing injections, Botox injections, sometimes in clinic, and we do those awake, and then sometimes sedated, especially if the kiddos are really anxious and it's not like trauma that we want to put them through, or if I'm doing phenol, which is very painful and it's also not something that I would do awake. So that's kind of like a typical week.
Wonderful. That was definitely something that during my rotations and spending some time with Peds Rehab caught me a little bit by surprise, but also makes a lot of sense. Is that sedation piece that you don't see a lot on the adult side, but it was very heartwarming because what you touched on, the trauma. These are young kids, right? And no one likes to be poked and prodded, whether they have a disability or not. So that's really heartwarming to hear that we do go that extra mile. Regarding the multidisciplinary clinic, I would be
Mhm.
interested to hear what benefits you have found in that multi-model of approach to care versus just, the typical clinic where kiddos and the families go for visits.
Mhm. I think that it's one of the joys of peds rehab is our multidisciplinary clinics. We take care of kids that have very complicated issues that we're managing and have several different specialties involved. I'll talk a little bit. We also have a multi-D. We have many multi-Ds, but another one is the movement disorder, and I think that one really speaks beautifully to how the whole process works. So for children with CP, they obviously have spasticity, they have dystonia, various movement disorders that impact how they function. And we've been really fortunate, I think, in recent years, and then there's more and more being developed in surgical management of the movement disorders. So both surgical management of the movement disorder itself and management of the complications of the movement disorder. So this involves our neurosurgery colleagues, this involves our orthopedic surgery colleagues, sometimes our neurology colleagues too. So the benefit is that we're all in the same room talking about a kiddo at the same time. So rather than kind of having families or other modes of like playing telephone, well, what did the neurosurgeon say? Okay, well, what did the orthopedic surgeon say? We're all there at the same time. We're talking to the family at the same time. We're helping them make informed decisions at the same time, right? So it's not a situation where you're having to try to piece together all these different components sometimes on your own. And I think the same thing goes for the spina bifida clinic is, if I'm seeing a kiddo and I'm like, oh, their function is not quite the same, they've lost some strength, their bowel bladder function has changed a little bit, I can tap my neurosurgery colleague on the shoulder and say, hey, this kiddo has lost function here. I'm worried about a symptomatic tether cord. And we can all have that conversation together in the same room and then talk to urology, and they can tell me whether or not they've had changes in their urodynamic studies that might match with having had a tether, right? So those kind of conversations, being able to have those at the same time, I think are really great. And I also think it's an added benefit to the families too. Something that I think it's always important to consider is that families take time out of their days to come to appointments. Sometimes they're taking time off work, kids are taking time off school. If we can minimize the amount of number of days that they're doing that, I think that's to a great advantage, and that can have multi-level benefits for the kids, whether it's like educational, not disrupting that, social, not disrupting that, or even for families, like not disrupting a source of income, right? So I think all of these things are the many, many benefits of having a multi-day clinic.
Yes, that is super, super great points. And another thing that, as you were talking about, I do feel like, unfortunately, at times disability tends to affect those from, lower socioeconomic backgrounds that might have to travel, especially aside from the fact that having to take time off from work, but also travel great distances to get to the location. So all of those added benefits, and also the fact that at times these could be really hard, life-changing experiences for a lot of these patients, and having that information kind of all at the same time, because I've definitely seen that, oh, but this is kind of what I heard, and then wait a couple of days to hear for this other consult. That can just get overwhelming in itself. Yes, like it's a lot of information being delivered, but just that waiting aspect when all parents want to know is like, what's going to happen with my kid?
Mhm.
I can definitely add I can definitely see how that will also take some of that emotional burden off
Yeah.
potentially, and just having that information. This is what we talked about. This is everyone that's involved in your child's care, and that can, be easier a little bit
Mhm.
for parents to digest. So, talking about families, and I feel like the multidisciplinary clinic is definitely a big way that you're able to, help parents engage a bit more and also empower them. But are there other ways that you've found to be beneficial to help engage and empower families per se?
Mm. Um, one of the other reasons I love peds, I think, or I feel that it's kind of a really special relationship that we get to build both with the kids and with their families. So in many different instances, you're meeting a family at a juncture that they did not expect. It's PM&R, that's kind of a core component of what we do. So whether that's at birth and you've had a major birth injury and brain injury that leads to CP, or whether that's a spinal cord injury, or whether that's a discovery of spina bifida, you're really meeting a family at a place that they had not expected to be. And I feel really grateful for the privilege to help guide them through that, because I think the empowerment is in the reminder of this has happened, but now we need to live, right? Life is going to keep going on, and we need to figure out how to do that. And how can I help you do that the most? How can I teach you how to advocate for your kiddos as they grow? And then how can I teach you to teach your kids to advocate for themselves and to remind and to kind of play that role in saying, this thing has happened, but they're still kids and they need chores. I tell some of my families, I'm like, okay, this has happened. They need a chore. Right? What are their chores that they're doing? It doesn't matter how small it is, but it's important to still have a childhood, to still have structure in many different ways, to still try to create what your version of normal is going to be. And so I think for me, my empowerment is in a way not limiting how you would choose to parent. I don't know if that makes sense, but really kind of like figuring out how you can expand it, and expand it to meet your child wherever it is that your child happens to be. And then also in like helping figure out what are the growth areas that your child has, and then what are the areas that we're going to need to support them in. And then this is just going to be a support that they might be lifelong or it might not be. But I think those are the kind of big general picture ideas of the empowerment, if you would.
Yeah. I love the little piece you shared about meeting the kiddos where they're at, but also create the version of normal that exists for you because and kind of what I'm thinking now is more so like unfortunate traumatic cases that I've seen where parents have pictures of what the kids used to look like and they put those pictures or the collage of pictures like above the kids like hospital bed, which at the beginning would just be very heartbreaking to see that it's just oh man, this is what they were and this is now. But a lot of times that gives you more understanding as a healthcare professional that this is the vision that the parents are still seeing the kids, and as healthcare professionals, we're seeing the kid after that potential traumatic injury, and that just helps us to kind of it is really hard. It is such, and again, I have I'm a medical student, but that 1 week that I spent on pediatric rehab, I feel like I've learned so many important life lessons because beside empathy that is so important just in medicine, but especially pediatric rehab, but that common ground of understanding and realizing that a lot of times parents have different expectations than the rest of the team because they're still holding on to this original picture. So having those meetings ahead, and just at times it might be repeating the same things in different ways because it's so hard for a parent to just realize that the new normal, like you said, is going to be different. The expectations I had, yes, I could still potentially do X, Y, and Z, but it's with a lot of added medical visits, or it might be not exactly how I pictured it, and that can be really heartbreaking for a parent. But at the same time, reminding them that hey, you're not alone. You have this amazing rehab team right next to you. That I just those were some of the things that I wanted to kind of echo with the empowerment and involving families in care.
Mhm.
That, like you said, is one of the really amazing parts of pediatric rehab for sure.
Correct. It's especially in traumatic cases, it's a mixture of it's a weird mix of celebration and grief,
Mm.
right? You're celebrating that my kid made it, like despite the odds, they made it. And then there's also a grieving, especially depending on how severe the injury is, of my kid made it and they're going to be different from what I remember.
Yeah,
And so being able to hold the both and of it as providers, I think is important because, like you said, we can get so in our, okay, we're doing this, we're doing that, we're doing that, but also to remember like this incredibly difficult, dissonant process
right.
that's happening for families. I think that's an important like consideration too.
Yeah. Humanistic medicine. That's what I feel like was kind of touched on here, which I love, and at times can be forgotten because like you said, we get so caught up on the go, 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 and we have to do X, Y, and Z that we forget that we just sometimes need to take time and give families the place to grieve and to make those realizations, but also celebrate that, we still have, your kid with us and it's hard, but we're here helping you and you don't have to go through this alone. And
Yes.
be able to connect them with the right resources. So on that note, what have you found to be beneficial? Because I think one of, again, my personal experience, what I loved is the amount of resources that are out there. And yes, it still can be very limited, but I found it to be very helpful once we could connect families to more of the resources that might not as specifically be like medicine related, but support groups and yeah, more so support groups. Have you found any specific resources in that way that you have thought to be super helpful in the recovery journey of your patients?
It depends. There isn't like one universal source
Mm-hmm.
that I would say. It just depends on the particular scenario. I lean hard on our social work colleagues because they're
Okay.
like the font of information. So if there is something local or specific, I'll kind of go to them. A
Mm-hmm.
lot of the times, diagnosis specific, I might send families down a particular path. Like if it's muscular dystrophy, I send them to mda.org because I think there's a lot of great information on there. Even for students and residents, I still and myself, I still go on there too because there's a lot of dystrophies and
Right.
muscle diseases, and keeping track can be tough. For cerebral palsy, AACPDM, American Academy of Cerebral Palsy and Developmental Medicine, has some great family resources. And then your CPF.com or .org has lots of great intro videos. They have a CP toolkit for families. So a lot of the times I will kind of send families in that direction. I tell them, go to this website and go get lost, and then go to other websites after that, but start here because
Right.
there's a lot of misinformation out there. The other thing that I might sometimes encourage families is if they're Googling and they run across something, they can always send it to me and I can be like, yes, this is reasonable, or maybe not so reasonable.
Right.
A lot of families have found support online, like Facebook groups. So there's been a lot of community that families have found in those scenarios. Obviously, I'm not a part of those groups, but they inevitably find each other.
For sure, and it really helps when you find other people who have gone through the same thing. That, and as much as providers, you can, as healthcare providers, you can provide insight. Oh, based on this patient, but I feel like it just adds another layer of support when you're able to connect with other parents who have had very similar experiences to what you're going through as a parent.
Mhm.
So I feel like you have touched on some of the rewarding aspects on how much you get to help out these kiddos and the families, but are there other rewarding aspects of your career that you'd like to share, or any patient success stories that has really stuck with you and has helped you to be the wonderful provider that you are today?
Um, I thought about this and I think there's so many little moments of rewards throughout the day that I just take joy in.
Mm.
So, like for example, I might kind of give some anticipatory guidance about, tone. I might say, "Hey, their tone is this right now, but when they grow, it's going to change to this." And the moment when the parent's like, "Doctor, you told me da 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 da," and then this happened, and I'm like, "You listen." That's
Aw.
rewarding. Like that, like what I said made a difference. Or I think most recently I just saw a kiddo that the very first time I saw him, and many times throughout that, he screamed through most of our visits. And then now he comes into clinic and he's so excited to see me and to show off what he's done and to like show off his new wheelchair skills. And the other day, like he showed me how he puts his shirt on and he did it by himself. Like these are, for me, those are like the tiny rewards, or the parents that say thank you for helping them see the potential in their child, or just keeping the window open to whatever that they can do. We have amazing stories on the rehab unit. We have kids that had profound brain injuries that you just, I think potentially even in an adult setting, they may not have made the progress that they made. But I'm thinking of one kid in particular who like is using the Locomat now, and those are,
Wow.
you can't make those kind of things up. And so there's so many little points of that. And I think, one of the many best parts about PM&R and pediatric PM&R is that it's not a solo effort. Like, it's such a huge team effort. Like, one thing couldn't happen without the other. It's just not possible. So what we do couldn't be possible without our therapy colleagues. How we support the families couldn't be possible without social work. How we help the kids that kind of get better, get ready for surgery couldn't be possible without our dietitians. Like, there's just so many things that all work together. For me, I'm hugely family oriented. And by that, I mean, not necessarily like blood family, but community also, I think, is an important component of that. And when we are working, for me, we spend a lot of our adult lives in work. And to be able to be in a setting where I still have that community of us working together towards a common goal, I think that's huge. I digress from your original question, but
No, that was a wonderful answer. I don't know if our listeners are looking, watching us virtually or listening to us on Spotify, but my face is like ear to ear, big smile, because what you were sharing actually is one of the big parts of why I love PM&R, that interdisciplinary collaboration and how much you are able to achieve when you have the helps of your colleague with the different specialties of PT, OT, social work, and it's never a one person job, but it's like, look at us all helping this wonderful family succeed. And I also think you kind of dismantle this misconception that a lot of times does exist in pediatric world in general, is that, oh, families can be like the hard parts of pediatric world. But I think especially in pediatric, we have having those conversations with the families becomes so important. But just the parents and the caregivers support, I think, just takes it that much farther of an extent. And a lot of times they want the kiddos to get better, so I've just personally found so much value whenever I've been able to talk to the families, especially. So that just kind of echoing the same sentiment that you were sharing. And yeah, so many golden nuggets of advice. Love that, love that. Kids are very, very resilient, absolutely. And there's a lot of life lessons that can be learned from working with them. And big kudos to you on your positive attitude, because I think just beyond working in medicine, that's how you are able to have that life or long-term gratitude from what you do. It's finding the joy, finding the positive in those little moments in your day, is that helps you to hopefully not be as burnt out as some of your colleagues, is to be able to see the positive and the value of what you're doing from day to day. So, which then translates to you providing ample care for your patients. So I just wanted our listeners to really, take that as we're all taking, part into our long-term professional journeys, to have this type of mindset, because it can really help us go far and be successful.
Oh no, 100%, 100%. And I would be remiss to not acknowledge how hard this is too. Like, I'm a huge believer in both and, if you can't tell. I think things are both and, like, it's not either or.
Yeah.
And in as much as there's joys, there is heartbreaking stuff.
Yeah.
And like you mentioned, the joy helps find a balance in the two. And so I have a practice of, in my phone app, I have a little chart and notes. And whenever I have these little joy moments, I write them down. And I put the date and I write a little, like, short little blurb about what happened. And then I have that to go back to. I may not necessarily remember all the things all the time, but if there's a really hard day, I can go back to that. And that same community and that same family that I mentioned at work, that's part of what makes it possible for me to keep going, is that we can then commiserate on this was hard and be able to be vulnerable in talking about that this was hard. I think that one of the things that for me is really important is, you mentioned the humanism in medicine. That's so important. I don't think you can go through this without acknowledging that we're human too. I don't think you can go through this without acknowledging that this impacts me too. The things that we see and help families through are very, very difficult. And to not acknowledge that, I think, would be a disservice to ourselves. Because then, that's might accelerate the burnout process and all of those things. Topic for a different day. Burnout comes from many different places, including the systems that we work in, but that's a different conversation. But we can control the things that we can control for ourselves.
Love that, because control the controllable, and that you can't pour from an empty cup. These are like two of my big mottos that I try to live my life by. And yes, I really appreciate that you brought the other side of pediatric rehabilitation rolled out, because you do see some really heartbreaking cases that can take a tremendous toll on your emotional health, on your mental health, and it's important to have those outlets, but also recognize when you do need help, when you do need to take a step back and talk to your colleagues or talk to a therapist, or do what it is that will truly fill your cup. Because again, it goes back to the you can't pour from an empty cup, and you want to be an empathetic professional and healthcare caregiver that can do the best for your patients. So I really appreciate you highlighting that. So we've kind of touched on a little bit about advocacy with the resources that you're able to share with your patients, and you encourage your medical students and residents to look at. But what have you found to be helpful that especially medical students and residents can advocate for children with disabilities and to help to promote awareness about pediatric rehabilitation medicine?
I think that it's important to think about where your skills and passions lie as it comes to advocacy. The reason I say that is earlier on, I think especially in residency and then in medical school, it doesn't seem like you have a lot of time, but you have a little bit more time to do a little bit more things. And so I know it doesn't seem that way, but there's a little bit.
It's okay, y'all. Don't be scared.
And I think that advocacy looks many different ways. So advocacy can be on the policy level. And so when I mentioned the time piece, like, do you have the time to get involved with your local policy organizations? Like in pediatrics and residency, I was really involved with the American Academy of Pediatrics. I did a summer internships at the office in DC and really got a chance to see advocacy at that policy level and to be a part of it at that level. So that's an option. Or even locally being involved with your local advocacy, whether it's school board, whether it's that being involved in local politics, wherever that might look like where you are, to advocate for kind of the rights of kids in that direction. So there's policy level advocacy. There's community level advocacy opportunities, right? So, I have a family that's advocating for accessible parks. Like that's something that's community level, like so a park being accessible. We don't think about that, but having a playground that's accessible to you is hugely important. So is there a way that you can advocate for that? As you're out and about in your community and you're going to restaurants, you're noticing, well, this isn't a very accessible entrance. Places to kind of enter through, like things to think about that way. So there's advocacy at a community level. There's advocacy at a peer level, right? I would be remiss if I didn't talk about there's certain misconceptions and stigmas that people have in terms of individuals with disabilities, and they're things that people say. And so even at a peer level, you have an opportunity to educate and to empower and to give like different perspectives, right? And so for me, I think about it in different levels. Like if I'm going into a room and there's a child present, always acknowledge a child. That's important. Like a lot of the times you're going to talk over kids and talk to their families, regardless of their functional level. It doesn't matter. You still acknowledge a child. I think that's important. And so that's even like a level of advocacy, right? Because that's like at that individual peer-to-peer teaching level. So I think for me, being able to teach that advocacy can look many, many different ways. It doesn't have to be one thing. This has also been a lesson to myself because I honestly really wanted to do more with policy when I was young. I was like, I'm going to do all these things. And I ended up not doing that. My life path took me somewhere different. And it was kind of like this is like a self-talk, a reminder to myself that it doesn't have to be at that level. It can look different. And so for anyone else out there listening, and if you had a particular thought of what it might look like, give yourself the space to consider that it might look different from what you expected, and that's still you advocating.
Yeah. Those are different layers of advocacy that I genuinely didn't consider. I really appreciate how you went from there's a policy, community, peer, self, but you're absolutely right. Acknowledging the kid, your patient first, rather than like just first looking at the parents, which I feel like a lot of us have the tendency to do. Not just kids with disabilities, but kids in general. And a lot of times, because you're like, parents, caregiver, oh okay, but that can take a lot, because by you showing that type of respect, right, then kids are able to expect more from themselves, that okay, I matter, this is my life, my journey, my visit, and that in itself can spark those, oh, I can handle this, oh, I taking ownership as to I matter. I don't know, these are just like some of the thoughts that I have, but that's such a wonderful reminder that advocacy doesn't have to be this set thing of I'm going to go to Congress and do it, or I
Yes.
have to. This is exactly what it looks like, but it can have more of that flexible look, and I appreciate you sharing that. And there's lots of resources out there, absolutely, from I'm sure like American College of Pediatric PM&R world that we can find even more. So that's really great. Thanks for sharing that. Um, so kind of changing gears a little bit and
Mhm.
talking about the advancements of the field. Have there been some recent advancements or innovations in pediatric rehabilitation medicine that has excited you recently?
Mhm. There's so many things happening all at the same time. I think there even things as subtle as things that we're already doing, but doing them slightly differently. For example, at our institution, so selective dorsal rhizotomy is something that you do for management of spasticity and cerebral palsy. And classically, you do this multi-level procedure. At our institution, we've been doing focal selective dorsal rhizotomy. So a kiddo that might have left hemiplegic CP, for example, and has really profound equinus tone, we might just do an S1 rhizotomy on the left.
Wow.
Right, and so I think and the, benefits of doing that, there's, like, multi-stages, like, it's not as big of a procedure, the recovery time is shorter, able to they're not necessarily in-house for a long period of time, and then they go out and kinda move on, so I think those are some, like, even smaller advances that are great. I think that medical technology is making huge gains. Locomat, I mentioned that earlier, so, like, being able to use robotics to assist repetitive gait training, I think that's, like, a huge thing. I haven't looked into it. The world of virtual reality has, like, dabbled in and out in terms of, like, its, feasibility and use, for therapeutic practice, but that's certainly something that's intriguing that's out there. Um, I have to go back through and see, like, what's happening, like, I know Duke has their study that they're doing on kinda stem cell, and CP, and I'm curious what that's gonna look like in the future. Um, AI? Question mark. I don't know yet. The jury is out on that one. I think that there
Right.
are benefits to AI, and then we'll just have to see kind of where that is taking us.
Mm.
The pieces that I hope for is or the challenges that I always struggle with is with all these great technology like the Trexo, for example, it's a really cool robot assisted walking therapy that you can do at home,
Mhm.
is getting that covered.
Wow.
Right. So we can have all these amazing cool things, but if it's not covered, it's not accessible. By covered by insurance, I mean.
Right.
So
What are
I
your
come
hopes on that?
I hope it will be covered. I mean, wouldn't that be amazing, right? If you're able to
Right.
100% cover this assistive therapy that can help a kiddo really like go further than they could with just outpatient therapy alone, wouldn't that be amazing? And
Mhm.
then they're more functional. And then as they're more functional through other mobility, perhaps they'll have less complications. If we're able to ambulate a little bit better or be upright or be moving, perhaps our tone can be better. Perhaps we might not get contractures. If our tone is better, if our contractures don't happen, maybe we won't need surgery. If we don't need surgery, we don't need a hospitalization, which is an increased cost. You know, those are my
Right.
hopes.
Right. No, I mean, it's a chain of effect. It's a domino effect that
Mhm.
makes sense to the thinking mind for sure. But then there's a whole other political and cost benefit that I personally would think would make sense. But again, that's a whole other world to navigate with different barriers to understand. And yeah, that's really, really good to hear. So what I'm hearing is that there is hope. There is lots that is going on in the future of pediatric PM&R world. And I didn't know that about the selective dorsal rhizotomy procedure. That's wonderful
Mhm.
to hear. So we are coming to the end of our episode, and I would love to hear if you have any final advice or encouragement that you would like to give our listeners that are medical students and residents considering a career in pediatric PM&R.
Do it.
Aw.
So if it wasn't evident, I love my job, and for many, many reasons. And also, I get to play at work. I mean, it's pretty
That's
awesome. I get to play at work.
that's so important.
We have pet friends. Children's hospitals are really bright, colorful places, amongst many other things. And then also keep a good hold on your why. If you have the ability to get experience in Peds Rehab specifically, take advantage of that if you can, even if it's just a shadowing opportunity to just kind of go in there and say, make sure, is this the right thing for me? Hold on to your why. I keep coming back to that. I think that's really, really important as you're going through, because it kind of helps remind you, like those moments when you kind of come down, like the why is like, there is my why. And then, I think I may have shared this with you before, but don't allow external factors to limit your potential. I think that's hugely, hugely important. It can get easy to forget a little bit about who you are as you kind of go through this training process, but it's important to kind of hold on to that. One of the things that I am recently learning more about is kind of this adult development theory. And there's a whole professional identity formation, there's a whole thing happening as you're going through medical school training. And it's all part and parcel of who you're going to be as a physician when you come out of it. And so kind of thinking about that and understanding that it's a dual process, right? You're here, you're learning, you're picking up all of these things. And as you're going through, pick up the things that you're like, that spoke to me. That was important. I want to do that in my life. Pay attention to the things that you were like, oh, and pay attention to why you had that response and what it is about that response that you don't wish to emulate in yourself later, right? And don't be afraid to speak up if you see something. It doesn't have to be on this grand schematic level where you're like going up the way, but especially if it's something on a peer level, that's how you make a difference. That's how you make a change, right? It's those little moments where you're not passive, but where you kind of trust yourself enough to be brave to say, hey, that felt a little off. Are you okay? Is everything okay with that? And check in on your friends, check in on your colleagues, check in on everybody around you. We're all going through kind of a tough time, you know?
Oof, that spoke to my mind, body, spirit. Loved, loved everything you shared. Um, that's such a one. I'm just collecting my thoughts because everything. It was just wonderful. It's such a mindful approach to your not just professional identity, but also your personal identity. Because a lot of times there might be those people who start their medical journey and they're like, all I want to do is to be a doctor. But I think as time is progressing, we are multifaceted beings. As human beings, we're multifaceted. It's just, I genuinely do not think that we can just be this one thing. And if we don't nurture ourselves, we can't have that expectation. And you see that day in and out in medicine, burnout, people quitting jobs and just not being happy with their life. And a lot of that stems from the fact that no one truly sat down with themselves and be like, what do I want to look like? Which is what you're encouraging us to do here, is to see, like you said, that there's different layers to it, and seeing what resonates with you, what doesn't resonate with you, and putting yourself in the position when things are resonating with you. That's how you become closer to your goals. And that is so, so important because, especially as females in medicine, I think speaking up can be a little bit challenging. But also, it's just, I'm thinking as a medical student side, it's just not something that's very welcomed. A lot of times you feel hesitant, but it is really important because at the end of the day, you are what who patients look up to. You will be the role model to the next generation. It's so important to have and develop these skills so that you can pass them on, but also have a life that you genuinely enjoy. And I loved how you have this practice of adding it's almost like a gratitude journal, but in your phone with your patients. That just makes it so easy to also have your why a little bit easier in the forefront of your mind. Because I've definitely had those moments, studying for board exams. That is not easy. There have been so many times in, just 4 years of medical education where I've been really challenged to my core. And what exactly helped is by reflecting on my why and remembering, oh, I'm here because I wanted to do this. And it just visualizing success, visualizing what, helping people can feel like, and that just can take you, it just can make things so much better and so much easier. And I'm going to stop here because otherwise I'll just be rambling, but I just really appreciate you sharing that. So yeah, that was wonderful. Thank you for that.
My pleasure. My pleasure.
Well, thank you guys for listening to this episode. I hope you found it as helpful as I did, and I wish you all a wonderful new year. If you have a few seconds, please leave us a review on our Spotify or Apple Podcast page and let us know what you'd like to learn about in the future. Until next time.